Hello, my name is Adam Kirking. I'm a Director of Operations with Imperium Health and excited to be here today to talk with you about ACO Health Solutions and how it can be used to support your practice within the Utah Physicians Quality Care ACO. Today we're going to talk a little bit about ACO Health Solutions and how the information is populated into it, tips for logging into the system, navigating the system, how to find and download your patient lists, what the quality registry section is, and how to use it to be successful in monitoring and managing your gaps in care for your patients over the course of the year. The report section, what to look for within those report sections and kind of who is most likely to use it in a few different ways. And then tips for adding users to the ACO Health Solutions portal. So to get started, ACO Health Solutions is an online portal that's going to have quality information, reports, as well as different patient lists and things that are going to be very helpful for you for being successful within an ACO. It's going to be populated mostly from claims data, although it is possible to also have information from your EMR and from maybe a manual entry source that can be used for monitoring quality, and then also going forward to our G-Pro, or that web interface quality audit that we're going to do January, February, March next year to make sure that we're being successful with our ACO quality reporting. So there's three sources of data that typically populate into ACO Health Solutions. The most common and the thing that we're going to see the most of is going to be the claims data. So we receive claims data monthly from CMS that has essentially every bill that was paid on every patient of ours. ACO Health Solutions is able to take this information, this kind of robust claims data that comes in for our patients, and populate it not only into the report section, but also into the quality registry section. And for you as a user, that requires no effort whatsoever, and it provides information to you that you're able to use in a few different ways. Sometimes we're able to extract EMR information, and typically we're going to do that by pulling a CCDA or having a CCDA extraction done from your EMR, or possibly by pulling some reports out of your EMR related to the different quality measures and trying to capture information to close those gaps in care. And the third way in which information can be entered into ACO Health Solutions is a manual entry, and that's would involve manual updates by one of your team members to closing those gaps in care to make sure that we are positioning ourselves to be as successful as possible during the quality audit. Both the EMR extraction and the manual entry are optional, but really highly encouraged because there's a great way to make sure that we are closing and tracking that information over the course of the year. So to get access to ACO Health Solutions, I know Lori set up many of you already, but if you did not receive access from Lori already, contact either myself, and again I'm Adam, or Lori at cc@upqc.org. So after Lori or I set you up, I would make sure that you're looking for an email from support@acohealthsolutions.com. Make sure you check your junk mail, check your spam. Sometimes it gets sent to people and they miss it because it got sent to the wrong folder or they didn't even know to look for it. So just make sure you're on the lookout for support@acohealthsolutions.com. And if you have any issues, please reach out to Lori or myself. So when you receive that email from Lori, and again, or from Lori myself, and that's again, it's going to be coming to you as support@acohealthsolutions.com. You're going to click on the link, and it's going to help you set up that initial login and set up that initial account for yourself. When I'm using ACO Health Solutions, I typically promote using Google Chrome or the most recent version of Internet Explorer or whatever internet browser you are using. Usually the most recent version of it is going to be helpful to make sure that all of the functionality within the portal works as well as possible. From time to time, you might need a little bit of password reset help or trouble with your account. If that comes up, please reach out to me. Please reach out to one of the UPQC team members to make sure that we're able to help you as soon as possible. Now, when Lori set a couple users up within each practice initially, she tried to set them up they were set up with admin access, which means that you not only have the ability to add extra users to your practice, but you have the ability to reset passwords for other team members within your group. The main website for ACO Health Solutions is pulse.acohealthsolutions.com. This is a site that I highly recommend you add to your bookmark, your favorite, whatever terminology you want to call it. Please make sure you save this account or this website because it's going to be one of the ones that you're going to go to the most to get ACO information. I know it's one of the websites that I go to the most personally. So once you're in the system, I love the way that ACO Health Solutions is set up with kind of a drop-down or a waterfall type approach. So there's different arrows that are going to be set up, and that's your way of kind of clicking through, and whenever you turn a horizontal arrow to a downward facing diagonal arrow, you're going to be able to see a little bit of extra information. Click around, navigate through the system, and that's going to be one of the best ways to discover and find a little bit more information for yourself. Sometimes it's also helpful to click on the words, and that will be a way to drill into some additional information as well. I'm a big fan of the phrase hover to discover, and whenever you hover and your little cursor turns into a hand, that's an opportunity to click down and see a little bit more or a little bit richer information about your patients or maybe a specific report. One of the first things that I always recommend when we have a new user logging into ACO Health Solutions is going into the patient section. Knowing who our patients are, who we're going to be evaluated by, and which patient's CMS is essentially grading us on from a performance perspective makes such a difference in terms of helping to improve our overall performance. So one of the first things I would say, go to your patient section and then export that list. That way you have a paper copy somewhere, or you're able to share that information with another team member. These are the patients that CMS says are attributed to us and attributed to our practice as part of being in a Medicare Shared Savings ACO. Whenever you see a disk, so the old computer disk up in the corner, that's going to be a cue for exporting or saving that information to your computer. So just be on the lookout for whenever you come across that. That's a great way to export that information for yourself. The next section within ACO Health Solutions that's really commonly used is the Quality Registry section. So the Quality Registry section is going to be populated by claims data, EMR information that we're able to pull as part of like a continuity of care document, or maybe some sort of a report, or it could be manual entry. The Quality Registry section is going to be the best way for closing and monitoring those 15 ACO quality measures over the course of the year. And if you're using it right, it's a way to essentially kind of work the quality audit or work that GPRO bit by bit over the course of the year to ensure that when it gets time for the actual audit, that you're best positioned to do really well and probably have to use a little bit less work during that stressful audit time. So the Quality Registry Performance section is going to be the best way to see how are we doing from a high level on all of the quality measures according to which patients will qualify for that measure. Now this is something that typically a practice administrator or maybe some sort of a leader is going to look at on a regular basis to just check how are we doing from our quality section. This is going to be probably most valuable right after you've uploaded your CCDA or EMR information to ACO Health Solutions, or it's the most recent release of the CMS claims data that was populated into the system. Usually that's going to be towards the end of every month that we're going to have those CMS claims files that are loaded into ACO Health Solutions, and the time when you're going to see the biggest changes within the Quality Registry section. ACO Health Solutions allows you to drill in at a patient level and see where are there opportunities to maybe close some of those gaps in care or identify which patients are eligible for the measures that we need to make sure that we're focusing on. So there's two ways in which we can identify and look at some of this information. The first that we're going to look at is going to be the gaps in care report, or it's almost like a patient level scorecard to see where are there opportunities for each of our patients. And the second is going to be we're going to have an opportunity to look at what claims information is populating into the system that helps ACO Health Solutions know that this is probably a patient that's going to show up in the audit or maybe more likely to be eligible for the audit. And then where is there information there or could be placed into the system that can be used to help close or satisfy that gap, that measure and that gap in care. So as I mentioned, that patient gap in care report, if we clicked on that blue link in the previous page that said gap, it would populate into this screen or it would open up into a new window. Now I recommend using this as a tool associated with your annual wellness visit as kind of a visual cue for which of the measures do we maybe need to capture information on, which have we already met or likely have claims data associated with it or have some other information associated with it, and which are measures that the patient doesn't qualify, either because they're not in the correct age, gender, or maybe have the specified condition associated with the measure. Using this gap report is one of the best ways to track your quality over the course of the year. And some of the practices that use this on every patient, they know that when it gets time for the actual audit, they're going to do very well, and they're probably not going to have to look quite as hard for some of the information because they know that they've captured it and it's going to be available within the quality registry section. Within that quality registry section, there's also that ability to see what information has been populated in that's helping to justify whether or not we need additional information for our patients, or maybe we have already entered information for the patients, or information is already available that can help to satisfy and close some of those gaps in care. When you're looking at this screen, the things that I would want to pay attention to are the measures that have that yellow box around them. Those are measures that we need extra information of some sort to help to satisfy that measure. The measures that are green, we already have information that can help to close or meet that measure. And the measures that are grayed out are ones that the patient doesn't qualify for, or at least it does not appear to qualify for at this point because of age, gender, condition, things that just don't qualify for that patient or don't help that patient to qualify for that specific quality measure. The next section within ACO Health Solutions that I frequently use or promote to practices is going to be the report section. So within the report section, there's a few different things that you're likely to look at. And the reports are going to be used by slightly different people for slightly different reasons. The report section, unlike the quality registry, which includes EMR or may include manual entry, is going to be populated only by claims data. Now that claims data is still very valuable and can be one of the best ways to track, is everything actually going the way we expected it to, and are we getting credit for the things that we expected to. The annual wellness visit report is going to be one of the most valuable and actionable reports within the ACO Health Solutions portal. So one of the first things that I always recommend that you do when you're looking at any of your reports is check the data service. Make sure that the data service that we're looking at is about what we expected. So when I'm looking at this report, I know that I'm only going to see about a month and a half's worth of data for the current performance here. So I would think of PY, where it says well visits PY, that's well visits performance year, meaning the year that we're being evaluated on. And as the information is populating in there, it's going to be showing year-to-date information. Now then, because the annual wellness visit is a once every 366 days visit, we also not only provide what's available year-to-date, we also provide what's available on a rolling 12 months basis. Because being able to track both of those numbers can help you not only track your progress this year, but what is your progress overall in the last 12 months, just to make sure that you're not missing an opportunity somewhere. So with the annual wellness visit report, if we click on that provider name, we're going to be able to drill down to the next level and see the patient level of information. Here we can take advantage of which patients have maybe never had a well visit, which patients are due for their next one, and as well as take a look at what was the last code billed for some of these patients to make sure that we're billing for not only the G0402, 438, and the 439 to capture all three of those codes over the course of our annual wellness visit program. One of the next reports that I will look at is the transitional care management report. This is one that's going to be really valuable for tracking maybe missed opportunities. We're starting to identify trends where we really need to intervene to improve maybe either our coding or our overall transitional care management workflow. So we're going to, at this report, be able to look at how often are we billing for a 7-day discharge? How often are we billing for a 14-day TCM visit, or that moderate level complexity TCM visit? And how often are we performing maybe another primary care visit within 30 days of discharge? So we can see what does the performance look like from a provider perspective. If you're a group that has multiple providers, this is going to be really valuable for identifying is there variation between providers. And then you can take it a step further and drill down to a patient level and identify where were there missed opportunities at a patient level. And then drill down even one step further to be able to see where were there missed opportunities from a facility level. And that's a great way to identify, did we tend to have missed opportunities associated with patients that maybe went to a skilled nursing facility? Do we have missed opportunities associated with a patient that went to a community hospital as opposed to an academic medical center? Identifying that information can be really valuable for going back and making some improvements within the way we're either receiving discharge notifications or acting on those to improve our overall performance. Being able to use or make a comparison of the 714 and other primary care code can be also valuable for going back to audit. Are we getting credit for the workflows that we have hopefully implemented in our practice? It's such a frustration if you are going through all the clinical work, going through the phone call, but you're maybe not getting credit for the work that you thought you were because a code wasn't billed or wasn't paid for correctly. So using this report from a manager level or from an audit perspective can be helpful to ensure that we're getting credit for all of the things that we should be getting credit for. Clicking on the disk or the printer on the top is going to be the best way to export this into an Excel file or to print this out for a little bit closer examination on your own. With this report, it's also very important to make sure that we're looking at the correct date range that we're after. So as we're filming this, or as we're recording this in late March 2018, we know that there's only about a month and a half's worth of claims data into the system. So for this example, I chose to go back to 2017 and looked at a little over a year's worth of information because it gave me a better snapshot for what does my overall TCM performance look like. Within ACO Health Solutions, we have the ability to see which of our patients have received home health over the course of the year. This allows us to see not only at a practice level of utilization, but also drill down to a patient level and a claim level on the part of the patient. I like to advise the group that sometimes with home health claims, you're going to see 2 claims associated with the same certification, and that's just the way CMS reimburses for home health services, where they often get a payment on day 1 and a payment on day 60 or the close of that claim. When I'm looking at the information within ACO Health Solutions as it relates to home health, I would encourage you to look more at the number of certifications per patient or the number of patients that have received home health services as opposed to the number of visits per patient. The number of certifications and the number of patients is probably a more actionable piece of information than the number of visits per patient, although the number of visits per patient can be important as you're looking to compare different agencies as well. There's an inpatient admissions by practice report that allows us to compare what does the utilization rate look like within our organization, and then drill down to which of our patients are maybe more likely to go back to the hospital or more likely to be seen within the hospital. This report is going to be dependent on how quickly the hospital sends their bills in and how timely we are about capturing all of that information for ourselves. This report, as well as that transitional care report, are going to be important and helpful, although they're not necessarily immediately actionable for performing a TCM visit, because this information is going to be populated by claims which is typically 30 to 45 days old. There is a high-risk patient report that allows you to come up with patient-level identifications or patient-level stratifications to test out theories, as well as identify those patients that are a little bit higher risk or a little bit more fragile and we really need to pay attention to. So we have the ability to use the drop-down menus for admissions, ER visits, and patient costs to narrow in on our target patient population, as well as select a number of these 6 chronic conditions that can be used to identify or used to drive which of our patients are maybe a little bit more risky. And if one of the conditions is listed as no, it means that it could be true. And if one of the chronic conditions is listed as true, it means it must always be true. So after we feel comfortable with those different sections and those different reports, it's important to make sure that we're giving the right information to the right people. Now, many of you were set up with admin access, which means you have the ability to reset passwords, create accounts, or reset accounts if someone's account happens to be frozen or disabled because of inactivity. So if you were given that admin account, you're going to have the ability to add other users within your practice. If you'd like to see another user added and you do not have admin access, reach out to Lori or myself and we'll be happy to help you right away. So if you're looking to add a user, click the plus and the person, or the person and the plus, and then you're going to have a link that pops up or a box that pops up, and you're going to and then be able to enter the email address of the person that you want to create an account for, and they will soon receive that email to set up their account from the support@acohealthsolutions.com. So if you're setting someone's account up, I would encourage you to make sure that you tell them that you're about to set their account up, and maybe do it in a way that they're able to act on it quickly to ensure that their account becomes live and it doesn't need to be resent out to them. As always, if you have any questions, please reach out to Lori or myself and we'll be happy to help you as soon as possible. Thank you very much, and if you have any questions related to ACO Health Solutions, please do not hesitate to ask. I think it's a really valuable tool and we'd love to make sure that you're able to take full advantage of it. Thank you very much.